Hello everyone, welcome to HIM 225. This is Lecture 5 in a series of lectures covering Chapter 22 in your textbook. If you will, please turn to page 538. We're going to begin at the bottom of the page at number C, pre-existing conditions versus conditions due to the pregnancy. There are some categories in Chapter 15 that distinguish between conditions of the mother that existed prior to pregnancy. Those are pre-existing, and then those conditions that are a direct result of the pregnancy. When we're assigning codes from Chapter 15, it's important for us to know whether or not a condition was pre-existing, meaning the patient had it prior to pregnancy, or if it developed during or due to the pregnancy, so that we can assign the right code. And two prime examples of this are diabetes and hypertension. There is gestational diabetes and there is gestational hypertension. For patients that have gestational hypertension, sometimes once they deliver, this condition completely resolves. Sometimes it does not. And it's the same thing with diabetes. I want us to take a look at these categories in ICD-10. So we're going to go to pregnancy complicated by diabetes. And you can see diabetes mellitus. We have a default code of 024.91. If it's gestational, it tells us to see diabetes gestational. If it's pre-existing, 024.31. And we have type 1 and type 2 here. We also have specified NEC. Let's go and look at this category. We're going to go to the beginning of this category, diabetes mellitus in pregnancy, childbirth, and the puerperium. You can see that this code of 024 is pre-existing type 1. It tells us that we also have to use an additional code from category E10 to identify any manifestations. And if there aren't any manifestations, then we're using the default code of E10.9, which is type 1 diabetes without complications. And then these codes are broken, as with most of the codes in this chapter, are broken down by trimester. So we will, if we have weeks gestation, we will convert those into trimester to get these codes assigned. If the patient actually delivers, then we're going to use the code for in childbirth. And if the patient has the condition in the puerperium, then we're going to use this code for in puerperium. Now you see this is diabetes type 2. And in the index we can see that it would be 024.11. And you have the instructional note here to assign a code from category E11, which is the type 2 diabetes codes, to identify any manifestations. If there are not any, then you would be assigning E11.9. And then we have our instructional note here about the long-term use of insulin. So this guideline is consistent. And then again, we have these codes for diabetes, pre-existing diabetes. 024.3, unspecified pre-existing diabetes mellitus and pregnancy, childbirth, and the puerperium. I would not expect you to use this code very often, if at all. Typically with OB patients, we definitely know what type of diabetes they have. The code for gestational diabetes, and it tells you here diabetes arising in pregnancy, gestational diabetes, NOS. as we look at these codes. You see that there is a code here for gestational DM that's diet controlled, and gestational DM insulin controlled, and gestational DM controlled by oral hypoglycemic drugs. So for these codes, you will include, this code includes the way that patient's diabetes is being treated. And if it's not documented, there is a code for unspecified control, but I would expect for an inpatient that you would have documentation of whether or not the patient was on oral meds, insulin, or whether or not they were able to control it with diet. Then we have gestational diabetes mellitus in childbirth. So this means that the patient has delivered. And then we have delivered, and then this is childbirth, gestational diabetes in the puerperium. And then we have other pre-existing diabetes, and this could be diabetes that follows the same guidelines for other diabetes, maybe due to the use of a medication. And then we have unspecified diabetes, childbirth, and puerperium. So that is coding diabetes. Finding the code in the index is fairly straightforward, so you have to carefully review the tabular to choose the correct code. Now let's look at pregnancy. Pregnancy complicated by hypertension. And it says to see hypertension complicating pregnancy. But you can also see that we have hypertensive listed here. And patients can have hypertensive heart and renal disease. It can be pre-existing. They can have hypertensive heart disease, pre-existing, hypertensive renal disease, pre-existing. If we have, if our patient has had gestational hypertension, we're going to hypertension, gestational, that default code is category 013. If they have proteinuria, we go to preeclampsia, and then if that gestational hypertension is complicating delivery or the puerperium, we have the specific codes here to look at. Now, I want to go to we're going to look at this category, which is proteinuria, hypertensive disorders in pregnancy. And you can see that category 010, pre-existing hypertension complicating pregnancy, childbirth, and puerperium, kind of corresponds to I-10, which is just the code for hypertension. And then 011, hypertension with preeclampsia, not 0, 011, 012, gestational edema and proteinuria without hypertension. 013, gestational hypertension without proteinuria. And then, excuse me, 014, preeclampsia, 015, eclampsia, and then 016, unspecified maternal hypertension. Let's take a look at some of these categories. And clearly you can see that this is pre-existing hypertension. So this is a category specific to an OB patient who had hypertension before she became pregnant. And you can see that also that these are broken down by trimester. And if the patient has heart disease with their hypertension, then we have these codes, this series of subterms as well. And then this is hypertensive chronic kidney disease, with hypertension with chronic kidney disease, and then the hypertensive heart and chronic kidney disease. So let's take a look at the top of page 539. Basically, it tells you if a condition exists before pregnancy, it's pre-existing. In this first example, the patient is seen by the obstetrician at 30 weeks for lab work related to her diabetes. The patient has had diabetes type 1 since childhood. So when we go to pregnancy complicated by diabetes, we're choosing type 1 because we know that she has type 1. We're going to choose the code for trimester. She is 30 weeks. That's the third trimester. So we're at 024.013. We're also going to assign the code for her type 1 diabetes. So in the index, we put in diabetes type 1. Now, she does not have any complications. There's nothing else documented here. So we can use this default code of E10.9, which is diabetes type 1 without complication. We also know that she is 30 weeks gestation, so we are assigning the Z3A.30 to reflect that 30 weeks. Now let's look at the next example. The patient has had varicose veins in her legs for years. She's now 22 weeks gestation, which is the second trimester, and she's complaining of pain in her lower extremities. The physician documents varicose veins. So in the index, we're going to go to pregnancy complicated by varicose veins, lower extremities, and we'll see this code 022.0. She's in her second trimester, so we will assign that code 022.02. Now she is also 22 weeks pregnant, so we'll assign Z3A.22 to reflect that. Now let's look at, on page 539, fetal conditions affecting the management of the mother. So we have two codes. We have two categories, 035 and 036. And these are for conditions that are known or suspected that there is a fetal abnormality and damage, and it affects, or some fetal problem that affects the mother. Now, these are assigned only when the fetal condition is actually responsible for modifying the management of the mother. So how is the mother's treatment for this pregnancy different because of this fetal issue? So an example might be, let's say that there is an infant, a mother who is pregnant with a baby who has Down syndrome. There is nothing that is done differently in the care of that mother because the baby has Down syndrome. And we do not code Down syndrome and put it on the mother's chart. After the baby is born, that code would be applied to the baby's chart. But there's nothing on the mother's chart that indicates that. She could actually have a code of 080 for a perfectly normal vaginal delivery, and that baby have Down syndrome. But if we have the case, for instance, of a mother who has a baby with spina bifida, and they decide to perform surgery, then we're looking at a different type of coding because that baby's condition affects the care of the mother. So let's look at this first example. This is fetal chromosomal abnormality with elective termination of pregnancy at 14 weeks. They insert laminara and then they perform an aspiration abortion with complete extraction of the products. So in this instance, this patient is admitted, the condition determined to have occasioned the admission, it is an elective abortion. So in the index, if we put in abortion and then induced, you'll see encounter 4 Z33.20. We can also put in counter and then termination of pregnancy, and we'll also get to that code Z33.2. So we also need to have a code that reflects that we have a fetal chromosomal abnormality. So in the index, we would put pregnancy complicated by fetal, and then we would find chromosomal abnormality. And this code, it has some Q codes here. We would not apply those Q codes at all. These are conditions that if we coded them, they would be coding to this category, but we're not coding them because the conditions are of the fetus, not the mother. So our code is O35.1. Now when we come to this category, we can go up and look at the instructional notes at the beginning of this category. We are applying a seventh character for the fetus. This is a single fetus, so we're going to be choosing a 0 for that, and so we're going to have placeholders. So our code is going to be O35.1XX0. Then we're also going to be coding remember we don't code the weeks gestation when it is an abortion. So we don't code that. But we're going to be coding these procedures. So in the index, I can put in abortion. And you can see they inserted laminaria. You can see that we have this code for laminaria. 10A07ZW. Now they also did an aspiration. That is a vacuum. And it's actually the same table, but as opposed to choosing the seventh character of W for laminaria, we choose 6 for vacuum. And so that is the code for the extraction of the products of conception with an aspiration abortion. So let's look at the next one. The mother presents for delivery. She's 40 weeks. The physician documents that the baby appears to be large for gestational age. The mother delivers vaginally a 7-pound baby girl without any complications. So this baby was not large for gestational age. The fact that she's term, she had a vaginal delivery, everything was completely normal. So this is an example of we would use the code of 080. We would assign the codes for a week's gestation and the outcome of delivery code. And in the index, we would go to delivery and then normal. We would see this code and category of 080, and this is the code that we would assign for that delivery. Now in the next example, we have a fetus is known to have spina bifida. The patient finds a surgeon trained in operating in utero and to have this problem corrected at 20 weeks. So this is a central nervous malformation of the fetus, and they do an open correction of that fetal defect. Okay, so we are back at pregnancy complicated by fetal. So in the index, we would go to pregnancy complicated by fetal spina bifida, and our code is 035.0. And we need to click on this code because this is a code that is impacted by the fetus, and we have one fetus, so our 7th character is 0. So where our code is 035.0 XX placeholders 0. Okay, and then this mother is 20 weeks gestation. So we are going to assign the code for her weeks gestation. And then she has an open reduction of this fetal defect. Now, they are performing this procedure on the products of conception. And if we just put in products of conception, we try to put that in, we don't find anything. So what are they doing it? They are repairing the products of conception. 10Q. This is an open procedure. There is no device, and it's being performed on the nervous system. And so this is our code for that procedure. Now that will conclude Lecture 5. Your question for Lecture 5 on page 555. This is exercise 22-3. I want you to answer question number 15. This is a woman who is 20 weeks pregnant. She has complications of blurred vision. So when the testing is done, she has a diagnosis of gestational diabetes. And so you'll choose the correct answer to that multiple choice question. That will conclude this lecture for Lecture 5 for Chapter 22.